Hello guys, good morning all, good morning everyone, good morning, good morning, good morning. Am I audible and visible to you all everyone? Good morning, good morning, good morning. Good morning people, if I'm audible and visible, please say yes in the chat box quickly. Hello Jeevan, how are you? What's up? Good morning Sudarshan. Good morning Manoj, good morning guys, good morning everyone. So I hope I'm audible and visible to you all. Good morning guys. I hope everyone is doing well. So myself, Dr. Siddhara sir, and I'm going to take care of your zoology subject for the next whole year. And definitely only one single target is there to get 180 on 180 in the zoology subject. Not a single question should be left out. That is our main aim. Yes? Do you agree on that? Yep. Do you agree, guys, that we can score 180 on 180? Very easily manageable. This year also, a lot of students have got 180 on 180. Many of our students on Gosalites got 180 on 180 in zoology. Not a single question has to be left out, because when the time gets difficult, your biology marks becomes your savior. So this time also for many students, biology has become the savior. So your biology, either botany or zoology, you should not lose a single question. Our aim should be only 180 on 180. Many students got very good marks in bio, but little bit they suffered in physics and chemistry, due to which with few marks, some 10, 15, 20 marks, some students are probably might not get the seat due to this discrepancy. And some students who made some silly mistakes, even some good students also have made silly mistakes in the zoology question paper, where they have lost a lot of marks. So what we should do this in 1 year. In this 1 year, I will tell you to follow one thing. Just be silent. Okay? Just be silent for 1 year. Just be silent for 1 year. Do your hard work quietly, silently. Don't be happy. Don't be sad. Just focus on work every single day, because a year of silence, dedication and hard work will bring you a lifetime of respect when you get into that medical college. And when your dream becomes successful, you are going to become a doctor. So that's why, as a doctor, you have to be patient. You have to be patient. Different kind of scenario will come in your hospital. Okay? Some life-threatening condition, some heart attack patient, some accident patient. If you get scared, if you get panic, how you are going to handle the situation? So you have to be mentally tough and strong. So I know you are disappointed right now. As a doctor myself, we don't want to repeat, but the challenge is so much, the competition is so much, that we have to go through this phase. It is a tough phase, but let me tell you, you are not starting from scratch. Are you starting from scratch? No. You already are experienced. You have experienced the challenges. Now you have to refine yourself. You have seen all the chapters. What are the different topics? What are the different traps? How are the different NCERT lines present? How they are twisted? How the questions are being asked? You know what is your weakness. You know, if I work on this weakness, I will definitely get more marks. So you have to focus on yourself. You are not starting from beginning. You are experienced now. You have some data with you. You know what is your weakness, what is your strength. You know very well where you went wrong. What mistakes did you do? So focus on that. Learn from that data. Adapt yourself. Adapt yourself to your mistakes, and then see throughout this year changing yourself. A beautiful metamorphosis is going to happen, and you are going to score brilliant number in your NEET exam, and that will easily give you a medical seat. Okay? Am I clear, guys? So I know becoming a doctor is such a big dream. It is a very emotional movement for us. Every day we are thinking about this. Okay, when I will crack the examination, when I will get a confirmed seat. So that is the biggest dream. Whenever I think about my preparation time, when I had a setback, when I gave the examination, first time when I attempted the medical paper, I also had a setback. Physics, chemistry, yes, that is a painful area, challenging area for medical students. Because we are not well versed with the mathematical part, we are not well versed with the calculation part. So we have to refine our skills. We have to refine our skills. We have to refine our concepts. We have to clear our concepts. Concepts you might be knowing, but clarity should be there. So let the dream be alive in your heart and work with all your dedication. Just be silent. Your dream is still on. You will definitely become doctor. Only the date has been changed a little bit. The date has rescheduled to next year. So probably by next June or July, you are going to get your medical college seat. You are going to get the admission. So what has happened? One small quote for you all. The dream didn't change. The dream has not changed yet. Today also, the dream is only becoming doctor, MBBS doctor. Just the date has changed a little bit. So we have to again get back to the work. Okay? So you know what is the work. You know what has to be done. You know, for zoology, we have to be master of the NCERT lines. And not only by hearting them. Simply by hearting will not help you. Batti kattu, what you say in Telugu, if my Telugu is not wrong, batti kattu, don't do batti kattu. Batti kattu is useful, but only when your conceptual understanding is there, your concepts are cleared. So today in zoology, when you see, there are many tricky terms, words and sentences. So whenever you study, whenever you pay attention in the class, see to that you understand every single word. Some tricky words are there, their meaning you should be cleared. Some sentences are there, just don't read superficially. Read it like someone has written you a love letter. If someone writes you a love letter, you will read with such a passion, right? What every single word has meant it. What the lover has written you, every single word meaning you will try to understand. Na? Similarly, read like that, it is a love letter. Read that zoology lines like that, full passion, full heart, full understanding, going deep in that. And if you are not understanding, then I am there to guide you. Because I have read many textbooks, reference books, and NCERT book is the main reference books, which I will help you to guide. Yes? So definitely we can crack. So clap cannot be made by one hand. Clapping sound cannot be coming by one hand. No? We require two hands. One yours, one mine. And we are going to make a huge clap. And that is going to help us to crack the NEET examination. What a phenomenal session taken by Pansar just before my class. He explained you very well everything, what you have to do, how you have to take care of yourself, how you have to study, how to follow academics. Leave everything else. Don't focus on anything. Just focus on the NCERT lines, NCERT textbook. NCERT is Bible for you, and not only just by hearting, understanding with some meaning. Am I clear? So just as a curious question, I want to ask, how many of you scored 180 in zoology? Be truthful and answer me in the chat box. How many of you scored 180 in zoology this exam? Some of you might have got 180 also. Yes, anyone? The paper was very easy. Many people say easy to moderate paper. Many people say easy to moderate paper is there. All the questions were from the NCERT lines. But looking at the scenario now, looking at the scenario of physics and chemistry, how the tough paper is being made, I am worried that sooner or later we can get a little challenging paper in bio also. So we have to be on our toes. Don't take biology lightly. Students who took biology lightly, they lost silly question marks. And that 10-15 marks which they lost might be the turning point of getting or not getting the seat. So see to that, our target is to get 360. Any batch you are, either you are in the gear up batch, either you are in the goal batch, biology, only one goal, 360 on 360, zoology, botany, 180 on 180. So when you target for 180, then if you fall short, one or two question, some silly error you did, then you will at least land up on 170, 175. And definitely you can do that. You understand very well. Lot of students I see, if the framing of the sentence is little bit moved and it is changed, you get trapped. So try as much practice possible this year. Just Gosalites paper you attempt from starting to ending. So many papers. Every week pace paper, every 15th day space paper, every month face paper. Then all this happens. Then you get the chase paper in the end. Then you have revision. In revision, you have the same pace, space, face, continuously goes on. Revision 1, revision 2, and then marathon question paper. So many varieties of questions we are going to practice. All the varieties are going to be roughly covered. But the thing is that you have to be dedicated from the first day to the last day. Don't lose hope anywhere in between. Sometimes you may score less marks. Sometimes the question may be little tough. The paper category might be tough. So we are going to practice you a lot of different categories of paper. Some easy to moderate, some moderate to hard, and some completely hard paper. We can make a lot of hard papers also only just from NCERT lines. Little bit tweaking and twisting and asking here and there data, we can easily make a tough paper. Okay? So this year, like NTA people made a trap. They made a relatively easier paper for zoology and botany as well. Many people completed it very fast. But when they went with happy, joyous mood, yeah, very good. Like riding on the horse, complete botany, complete zoology, very well. But then it was like a Trojan. The biology paper was like a Trojan virus. And it created a trap for the physics and chemistry. And then with such a positive motivation, when you attempted the physics and chemistry, and definitely a lot of challenging questions were there, a lot of question types were there which were asked for first time. In fact, they are not rather asked in the NEET papers. They might be asked in the JEE or JEE mains or advanced paper. Some questions were of advanced level as well. So don't fall in that trap. Learn to write the paper. Like when we play cricket, we are taught one simple thing: play every ball on the merit. If the ball is on the good length, okay, and good length ball to pick up is very difficult. Yeah. So for that ball, you have to give some respect. If the ball is coming full toss, yeah, you can move your bat. But sometimes full toss ball, you give the catch. Your shot is not timed properly. So some easy questions also make you trapped. So every question, take it seriously. Don't be in a hurry. solve paper properly. And being said that, we are going to start with the discussion of the paper. Today I am going to discuss the Re-NEET 2026 paper. We will see the questions. We will see the questions connected to it. And from next class onwards, we are going to start with the topics. Like in the next class, we are going to start with structural organization in animals, where we are going to talk about the basics of tissue understanding, animal tissue we are going to start with. Are we clear, guys? Yes? Everyone getting me? Sir, we have to bring our old notebook. Yes, if you are an old Gosalite students, definitely you bring your old notebooks, no problem. If you are not having it, like if you have lost it, if you have thrown it, so it's no problem. Again, we can make the new notes. Are we clear, guys? So let us start with the paper. Okay, so let me check where is the paper. Here it is. So Re-NEET 2026 paper, paper code number 60. Let us start with the first question. Question number 92. Okay, everyone? Audible? Is the PDF visible to everyone? Is the PDF visible to everyone, guys? Tell me. PDF visible to everyone? Words are clear to everyone? Sir, offline, online, same track? Yes. Offline, online, same track will be there. There will be no difference. Question paper also will be same. But I will suggest to join you in the offline mode so that your doubts are being cleared more. Online students, they study well, but only one problem I have noticed. Their doubts are not much cleared. And when offline student is sitting in front of me, when I come for study hours, they can easily ask me the doubt. And when they ask me the doubt, when a student asks me a doubt, I understand what is the conceptual understanding of the student. Has he understood the concept correctly? Or sometimes the students just mug up the line, just by hearts the line, have not understood the line clearly, and that's why they mark the wrong answer. Are we clear? Sir, is it goal or gear up? No problem. Goal, gear up, faculty, all everywhere is good. Only in gear up, we are teaching at more basic level. Okay, at goal we are going little higher level. But NCERT is completely taught in both the batches. Okay, so it is like creating a competitive environment. It is not that goal and gear up are very different. It is like a competitive environment. We are competing. So the shuffling will happen throughout the year with the gap of months. Okay, like if you're performing to goal batch, if you're not doing good in the goal batch, then you be sent back to the gear up batch. Like some of our Indian cricketers, they were not doing good. Virat Kohli had a bad patch in between. Rohit Sharma little bit had a bad patch. They were asked to play the Ranji cricket. Is Ranji cricket bad? No. A lot of big cricketers come and play. They also played many games, refined their game, again went into the main Indian cricket team. So everywhere you have to perform. So in gear up also you have to perform, in goal also you have to perform, and that creates a healthy competitive environment. Are we clear with this, guys? So not much difference. Going ahead, which of the following is not the characteristic of chordates? So what are the characteristics of chordates? Tell me, guys. What is the characteristic of chordates? Chordate characteristic is, first of all, dorsal hollow nerve cord, then notochord, then pharyngeal gill slits, then post-anal tail, ventrally. Okay, so post-anal part is the feature of chordate. Presence of notochord is the characteristic of chordate. Central nervous system is dorsal. Now in the chordate paragraph, central nervous system word is not mentioned. What word is mentioned? What is mentioned, guys? Tell me. In the NCERT, what is mentioned? Tell me, guys. In the NCERT, it is written as dorsal hollow nerve cord. What it is written? It is written as dorsal hollow nerve cord. Yes or no? Dorsal hollow nerve cord is the feature of the chordate. Yes. Now think a little bit. If the chordate develops, the dorsal hollow nerve cord will also develop. A dorsal hollow nerve cord is going to give rise to brain and spinal cord. This is going to give rise to brain and spinal cord. This is going to give rise to brain and spinal cord. What? Brain and spinal cord is nothing but central nervous system. Are we clear? So see, small trick they have used here. They have written dorsal nervous system is dorsal. Now many students thinking that, sir, central nervous system is not mentioned in the chordate, so I marked this. But what about gills? Gills are present, na? Gill slits. Chordates show presence of gill slits. So central nervous system is our dorsal hollow nerve cord. So this is present, this is characteristic, this is characteristic. Chordates also have gill slits, but they have written absence of gills. Absence of gills is not characteristic of chordates. In fact, gills is present in non-chordates also. Gill slits is present in chordates. So absence of gills will not be the characteristic. That's why we have taken this as an answer. Are we clear with this, everyone? Are we clear, guys? Yes or no? Are we clear? Is this question clear to you? Any doubt? We will go to the next question. So let's quickly go to another question, 92. After 92, next question, 94. Chemical coordination chapter. Chemical coordination chapter. Which of the following statement is incorrect? Which of the following statement is incorrect? Okay. Glucagon stimulates glycogenolysis. Glucagon stimulates glycogenolysis. What is the function of glucagon? Tell me, guys. Whenever you are hungry, like if you are having upavasam, you are not eating anything, you are showing starvation. If you were showing starvation, your blood sugar will go down. You will suffer from hypoglycemia. What you will suffer from, guys? You will suffer from hypoglycemia. So we need to understand the concept. So in pancreas we say there is islets of Langerhans. Islet of Langerhans. Here we say there are two cells. One is alpha cell and one is beta cell. Alpha cell releases glucagon hormone. Beta cell releases insulin hormone. Yes? Now, what is the role of the hormone? What is the role of the hormone? They are regulating your blood sugar level. Glucagon and insulin both are regulating your blood sugar level. Now you tell me, which reduces blood sugar? Insulin. Insulin reduces blood sugar. Who will increase blood sugar? Glucagon will increase blood sugar. So whenever you are under starvation, now what is the meaning of starvation? What is the meaning of starvation? Starvation means you are hungry. Let's say you didn't have any breakfast. No breakfast. Now it is afternoon time. You will be hungry. Your blood sugar level will be down. So starvation will lead to low blood sugar. It will lead to low blood sugar level. Low blood sugar, glucose level is going down. What it will be called as? Low blood sugar is called as hypoglycemia. Low blood sugar is called hypoglycemia. Hypo means low. Glycemia means sugar. Hypo means low. Glycemia means sugar. Yes. Yes, Rahman. Hypoglycemia, correct word. Yes, Tulsi. Hypoglycemia is the correct answer. Sir, is the next class on Saturday? So today is Thursday. Saturday is zoology. Yes, Murli. Hypoglycemia. Is hypoglycemia good or bad? Tell me. Is hypoglycemia good or bad? Your blood sugar level is going down. Your brain is not getting enough glucose. You will feel faintness. चक्कर आएगा आपको, dizziness, yes or no, weakness in the body, the person may fall, the person may fall down. So your body will try to increase blood sugar. You are going under starvation, you are keeping yourself hungry, your blood sugar is going down, someone need to increase blood sugar. Who will come to rescue? Who will help us? Who will help us? Glucagon. Who will help? Glucagon. So this is the stimulus. Hypoglycemia is the stimulus. Hypoglycemia is the stimulus for which one? It is the stimulus for the alpha cell of the islet of Langerhans, and what will be released? Glucagon. What will be released? Glucagon. Glucagon will help us to increase blood sugar level. Where will glucagon bring the glucose from? Glucagon first, it will give command to liver cells. It will first give command to liver cells, hepatocytes. It will tell the hepatocytes, do the breakdown of glycogen. Glycogen. What is glycogen, guys? Glycogen is a polysaccharide. Glycogen is a polysaccharide. In your liver, you have stored glycogen. So you need glucose. Your blood sugar level is down. So glucagon gives the command to the hepatocyte cells to break down glycogen to glucose. To break down glycogen to glucose. What is this process called as? What is this process called as? Glycogen to glucose. What is this process called as? Glycogen breakdown. Glycogen breakdown. Glycogenolysis. What we will call it as? Glycogenolysis. Are you getting me, guys? Are you getting me? Glycogenolysis. So glycogenolysis is function of which hormone? Function of glucagon hormone. Function of which hormone? Glucagon hormone. And this glucose goes in the blood. This glucose goes in the blood. Okay. I extended my starvation. I am keeping my upavasam for another day. One day I did upavasam. In reality, I cannot. But I extended one day more. Second day of upavasam. Now I am needing more energy. Glycogen is over. Glycogen is completely over. Now what my body will break? My body will now start breaking my fats. Now it will attack the fats. Now the glucagon will give the command to the lipids, the fats, and the lipids will go under breakdown. The lipid go under breakdown. They will go under lipolysis. What they will go under? Lipolysis. Lipolysis, lipolysis, whatever you pronounce. So if you want to lose weight, if you want to have fat loss, which hormone will help us? The hormone glucagon will help us. But for that, we have to do upavasam. And upavasam is risky. Upavasam is risky because your blood sugar level will be very down. Are we clear? So lipolysis occurs, you will get fatty acids, and from the fatty acids, in the liver, we can regenerate glucose. Glucagon will give command to lipids. Lipids will go under breakdown lipolysis. Lipolysis will give you breakdown of lipids. Lipids will break and give you fatty acids. Fatty acids will be channelized in the liver to make glucose out of fatty acids. So you can make glucose from fatty acids as well in the liver. Okay. Now again, I want to extend my upavasam. I am extending my upavasam on the third day. Now this is becoming a little dangerous. Already I am 2 days fasting done. Glycogen over, lipid over. Now if I go for more hunger strike, if I go under more hunger strike, more starvation, who is next on the line? What I will break now? I broke my glycogen, I broke my lipids. Now what I will break? Now I will break my proteins. Now glucagon are going to act on proteins, and proteins will undergo proteolysis. They will undergo proteolysis. This is very dangerous. Very, very dangerous. Why very dangerous? Because you are breaking your muscle. Protein are building blocks of the body. Last option is protein. We don't want to make protein, but since we are hungry, we have to survive. We need energy. So we will break protein, proteolysis. Proteolysis will give you amino acid. Amino acid will be again channelized in the liver to make glucose. Proteolysis gives you amino acid. Amino acid will be channelized in the liver in some cascade of reactions that will give you glucose. So basically, when in need, when your body is in need, when you are starving, hungry, no energy source in body, no food leda, first glycogen breakdown, glycogenolysis, glucose in the blood helps us. Not eating anything, again lipid will be broken down, lipolysis, glucose will be increased. Next, protein will be broken down, proteolysis, amino acid will be converted to glucose. So basically your glucagon will break everything in your body. First glycogen, second lipids, and third is your proteolysis. Now basically synthesizing, okay, or synthesis of new glucose molecules from a non-carbohydrate source. From which source? Non-carbohydrate source. Glycogen is carbohydrate? Yes. Glycogen is carbohydrate? Yes. Glycogen is carbohydrate? Yes. Glycogen can break down and give you glucose. But sir, protein is breaking down into amino acid and giving glucose. Lipid is breaking down into fatty acid and giving glucose. Sir, however, lipid and protein are not the natural source of glucose, na? Protein and lipid are the protein breakdown, amino acid, lipid breakdown, fatty acid. But this fatty acid and amino acid can give you glucose. So whenever you are synthesizing new glucose molecules from a non-carbohydrate source. Which are the non-carbohydrate source? Lipid and protein are non-carbohydrate. You are making glucose from breakdown of lipid and protein and synthesizing new glucose molecule. What will be this called as? This will be called as gluconeogenesis. What it will be called as? Gluconeogenesis. What it will be called as? Gluconeogenesis. Gluco means glucose. Neo means new molecule, naya molecule, new. Genesis means formation. So when you make glucose out of protein breakdown and lipid breakdown via glucagon hormone, it is called as gluconeogenesis. So basically proteolysis and lipolysis, they help you in making gluconeogenesis. Where all this thing is happening? In the liver. Where it is happening? In the liver it is happening. Are we clear with this? Are we clear with the glucagon function? Are we clear with the glucagon function? So ultimately hypoglycemia, that is low blood sugar, or glucose level less is the stimulus. It is the stimulus for the alpha cell to release the glucagon, and glucagon will cause three things. It will cause glycogenolysis, it will cause proteolysis, it will cause lipolysis. Everything will be broken down. Break everything. Break glycogen, break protein, break lipid, break everything, and convert them into what? Convert them into glucose. Glucose level increases in blood. Glucose level increases in blood, and this will be called as what? This will be called as hyperglycemia. So what we achieved, guys? What we achieved finally? We finally achieved hyperglycemia. So glucagon helps us to elevate blood sugar. That's why we call glucagon as hyperglycemic hormone. Glucagon helps to increase blood glucose level. Glucagon is called as hyperglycemic hormone because it helps to increase the blood sugar level. Are we clear with this, guys? So are we clear with the statement? Glycogenolysis, lipolysis, proteolysis, gluconeogenesis. Many students first time when they hear they get confused. They find it very difficult, but actually it is very sensible. Yeah, your body demands energy. Break everything. Break everything. Arey, you don't have money. You will sell everything. Na, your bank balance will be empty. You will sell everything. You want money to survive na. So similarly, your money is glucose. Energy, ATP source is glucose. So break everything for the glucose. That is the job of glucagon. Are we clear? Next hormone is insulin. Next hormone is insulin. Come on. Let us talk about insulin fast. So let's say you eat food. Yes? You ate some food. Let's say you had some 10-15 idlis. Okay? Very hungry, morning, went into the mess. 10-15 idlis, daba ke kha liya. So a lot of idli went inside. Okay? Or some rice is there, tiger rice, lemon pulihara, whatever is there. Kha liya. So when you eat food, your body gets energy. The glucose rushes in the blood. You will digest the food. Glucose will be absorbed in blood and your blood sugar level will rise. So after eating food, what is going to happen? Tell me, guys. After eating food, your blood sugar level rises. Your blood sugar level increases. What is this called as? Blood sugar level increases after eating food. What is this called as? This is called as hyperglycemia condition. What is this called as? Hyperglycemia condition. So after eating food, इतना ठूस लिया, इतना खा लिया है, blood sugar level elevate हो गया. Blood sugar level has elevated. Now this condition is called as hyperglycemia, high glycemia sugar, high level of sugar. Is this good or bad? Hyperglycemia is good or bad? Low glucose level, energy down, you will fall down. Very high blood sugar will damage your heart, kidney. Yes, high blood sugar level can damage your kidneys, can damage your eyes, can damage your heart. Yes, that is bad. So hyperglycemia condition is not good. So this will be a stimulus. This will become a stimulus. This will become a stimulus. This will become stimulus for which cell? It will become the stimulus for beta cell. It will become the stimulus for beta cell, and beta cell is going to release which hormone? Tell me. Beta cell is going to release your insulin hormone. Are we clear? Beta cell is going to release insulin hormone. Now insulin hormone, what it will do? What will insulin hormone do? What is the problem? What is the problem? The problem is that blood is having very high sugar level. This much high sugar level is not good. I need to take that sugar from blood and store in my body. So what the insulin will do? Insulin will channelize the excess glucose in liver cells. If more excess sugar is there, channelize in adipose tissue. So insulin will call all the glucose from the blood. All nahi, excess glucose. Because if you call all the glucose from the blood, if you remove all the glucose from the blood, the person will fall down, hypoglycemia. So insulin will remove excess sugar. Some sugar, glucose go into liver cells. Glucose will be converted into a polysaccharide glycogen, will be stored there. Other excess glucose which is there, it will go in the fat cell, adipose tissue. Their excess glucose will be converted into fat. So we are going to do two things here. Glycogenesis, glycogen formation. Fat formation, lipogenesis. So insulin will channelize excess glucose from the blood Please understand why I am writing excess glucose. I can also write glucose from the blood, but I am writing the excess part because some glucose is required there in your blood. Okay, some 70 to 100 milligram per deciliter of blood of glucose is required. After eating food, your sugar rises to 200, 300 milligram per deciliter of the blood. That is too high. So whatever excess is that will be channelized from your blood. From the blood, the glucose will be removed. It will be given to two cells. First, some of them will go into hepatocytes. Some of them will go where, guys? Some of them will go into hepatocytes. Some of them will go into hepatocytes. Yes. The cells will utilize glucose. Yes. Very correctly written, Venugopal. So hepatocytes, what they will do? The glucose molecules, the n number of glucose molecules will be converted to glycogen, and this process will be called as glycogenesis. What it will be called as, guys? It will be called as glycogenesis. Are we clear? Okay. Now liver cells say, oh, we are full. We are completely full with glycogen. There is no space. Space leda. Space ledu. Where the excess glucose will go now? Then the excess glucose remaining will go in your adipose tissue, fat tissue, lipid cells, adipocytes. Remaining excess glucose will go in the adipocytes. There the glucose will be converted into fats. This glucose will be converted what into, guys? Fats or lipids, and this will be called as lipogenesis. What is this called as? Lipogenesis. So which hormone makes you fat? Which hormone makes you fat? Which hormone makes you fat? Makes fat in your body? Insulin. Which hormone? Insulin. But when does insulin releases much? Insulin makes you fat, na? But when insulin releases, what you did so that insulin released more? What you did that insulin released more? Array, you ate the food. So don't eat too much. Because if you eat too much, lot of sugary food, lot of starchy food, lot of rice, lot of carbohydrates if you consume, that excess carbohydrate will be channelized into fatty tissue and you will become fat. Am I clear? Am I clear, guys? So that's why your diet should be balanced. Carbohydrates, proteins, lipids, okay, fiber, dietary fiber, or else you will get constipated. Are we clear with this, guys? Yes or no? Are we clear? So what did insulin do? Ultimately, blood sugar level is reduced. What is the ultimate effect? The ultimate effect is that blood sugar level is lowered now. The ultimate effect is blood sugar level is lowered. Whatever excess blood was there, it went into fats, it went into the hepatocytes. Blood sugar level is down now. Blood sugar level reduces. You achieved hypoglycemia to normal levels. Blood sugar level decreased to normal level. To which level? To normal level. Please remember, to normal levels. Blood sugar reduced to normal level. That's why insulin is called as which hormone? Insulin lowers blood sugar. That's why you call insulin as hypoglycemic hormone. Are we clear with this, everyone? Are we clear? Okay. So now we will see that question. However, the question was very easy. Question was a lollipop question. But why did I taught you this? Because students, again and again, they have the confusion between glycogenolysis, glycogenesis, lipogenesis, lipolysis, gluconeogenesis. They are always confused with all these terms. So again, don't do batti kattu, apply some logic, apply some common sense, and then automatically you will understand the concept. You may take little time to solve the question and you will get the right answer. Are we clear? ठीक है, I have not completely taught everything in this. Little bit more data can be given. Insulin deficiency causes diabetes mellitus, because when insulin deficiency occurs, blood sugar will not come down, hyperglycemia will be there, excess blood sugar will go in the urine, glycosouria, glucoseuria, ketonuria, diabetes mellitus will occur due to deficiency of insulin. So these are the applied topics of this hormone, which we will study chemical coordination. Then we can very easily, coolly understand the whole topic. This is just like a trailer, teaser. You can understand a little bit of the concept. Are we clear with this, guys? Okay. Now let's go to the question. So what is the question asking? Question is very simple, by the way, guys. Which of the following statement is incorrect? Incorrect statement. Glucagon stimulates glycogenolysis. Yes, glucagon will stimulate glycogenolysis because glucagon increases blood sugar. Correct statement. Beta cell secretes insulin. Correct hai. We want incorrect. Alpha cell secretes insulin. Wrong. This is a wrong statement. That is why this is our answer. Okay. Next statement. Okay, this is botany question. Then skipping. This is also botany. Yeah. Easy question from the frog chapter. Easy question from the frog chapter. In water, frog respires using what? So frog respiration, in water it is using skin. What is the skin respiration also called as? Come on, tell me in the chat box. What is the skin respiration also called as? Some of my old students are there, okay, listening. On land it will use lungs also, skin also, buccopharyngeal respiration also. In hibernation and estivation, it will only use the skin. Yes, correct answer is cutaneous respiration. So if skin was not given, if I am the examiner, other than skin, I can give another word. Cutaneous respiration is the another word for breathing via skin. Okay, moving ahead. Next question. Okay, this is botany. Here, which of the following statement is incorrect? Which of the following statement is incorrect? So this question is about blood clotting. So how we talk about blood clotting? Tell me, guys. How we talk about blood clotting? So we say that whenever we got injured tissues, whenever we get injured tissues, they release certain factors. Okay, factor is not mentioned in the NCERT. We can say it is thromboplastin. It is what? Thromboplastin. So injured tissues and platelets both will release certain factors. Injured tissues and platelets will both release certain factors, and this thromboplastin will help you to synthesize prothrombinase enzyme. And in the presence of calcium, your prothrombin, what thrombin? Prothrombin is an inactive blood clotting protein. What it is? It is an inactive blood clotting protein, and it will be converted. So sorry, not prothrombinase. We can write thrombokinase here. No issues. Okay, prothrombinase, thrombokinase, both are okay, but go for the NCERT enzyme. In the presence of this enzyme, this will be converted to thrombin, and thrombin will also behave like an enzyme, and it will convert the fibrinogen, which is also inactive, into what? Fibrinogen will be converted into fibrin. Fibrin threads will be formed. Like this, fibrin threads or mesh will be formed, and finally this fibrin will dry up, and now you are going to get the clot. Now you tell me, guys, have you ever got injured? You got blood clotting, and when I put water on the blood clot, will it dissolve and go away? Will the blood clot get dissolved and go away? Tell me. If you put water on the blood clot, will it dissolve? So means when I am bathing, the blood clot will go away? It will not. Blood clot are having insoluble proteins. Fibrin is insoluble proteins. Fibrin is insoluble. Fibrin blood clot is insoluble protein fiber threads. Whereas fibrinogen, which is inactive, which is present in your blood, that is moving in the blood plasma, it is present in which form? It is present in the soluble form. What form it is present? Soluble. So if I am an examiner, I will like to ask such questions. Fibrinogen, soluble. When it becomes activated, it becomes fibrin. Fibrin will be insoluble. That helps you to make the blood clot. The mesh, what you see is the fibrin thread mesh. Are we clear? So now going to our question. Question is relatively easier. What is the question asking us, guys? Tell me. The question is asking here, which of the following statement is incorrect? Fibrin is produced from fibrinogen. Yes. Calcium is required for the enzyme activation, Yogi Vardhan. Fibrin is produced from the fibrinogen. Yes. Second statement, fibrinogen is produced from fibrin. That is incorrect. Fibrin you get from fibrinogen. You cannot get fibrinogen from fibrin. Blood coagulates in response to injury. Yes. Blood consists of fibrin threads. Yes. This is also correct. So this statement will become an incorrect statement. Okay. Moving ahead to the next question. Directly going to animal kingdom question. I think, yes, this is our question. Animal kingdom statement based question. Let's see this. So what is statement 1 saying? Statement 1 is saying the class name of reptilia refers to creeping or crawling mode of locomotion. Where it is given in NCERT. In NCERT, after reptilia word, they have mentioned reper or reptum. Reper or reptum means what? Reper or reptum means to crawl or creep. Reper or reptum means to creep or crawl. So basically reptilia name is given as per their locomotion. Class reptilia name is given as per their locomotion to creep or crawl. That is a correct statement. Similarly, birds. What is the class bird called as? What is the class of the bird called as? Aves. Where does the aves word come from? Where does the aves word come from? The aves word is coming from avis. It is coming from the word avis. Avis. A-V-I-S. Avis. What is the meaning of avis? Avis means to fly. Aviation. Avis means to fly. So again, aves also, their word is connected to their locomotion. Mammary glands, mammals. Are we clear? Yes or no, guys? Moving ahead. Where is our question paper? Why it is switched off? Okay, suddenly the question paper snapped here. Okay. Just hold on a second. So where were we? Yes. So first statement is correct. Second statement you can see clearly incorrect. All the reptiles have 3-chambered heart. False. Crocodile 4-chambered. Alligator 4-chambered. Gharials, caiman, this all belong to Crocodilia family. So crocodile, alligator, gharials, they look like all crocodiles only. So they have 4-chambered heart. First statement correct. Second statement incorrect. Moving ahead. Next point. Frog question. Frog. Frogs have how many pair of cranial nerves? Frog have how many pair of cranial nerves? Frog have 10 pair of cranial nerves. What about humans? What about humans? Frogs have 10 pair of cranial nerves. What about humans? Tell me. What about humans? Humans के पास कितना है? What do you mean by cranial nerve? Tell me. What do you mean by cranial nerves? The number of pair. Pair is asked. Pair is 10 pair. If the examiner wanted to be little smart, if I remove the word pair, then you would have marked 20. Okay, humans have 12 pair of cranial nerves. And what is the meaning of cranial nerves? Where do cranial nerves come from? What is the origin of cranial nerves? What is the origin of cranial nerves? Where do they originate from? Tell me in the chat box. Cranial nerves arising from what? Arey likha hai idhar. Brain, CNS, yes. Humans are having 12 pairs. What about spinal nerves? What about spinal nerves? Spinal nerve in frogs, 10 pairs. Spinal nerve in frog, 10 pairs, that is 20. For humans, it will be 31 pair. For humans, it will be 31 pairs. Are we clear? Our spinal cord is very big. Our spinal cord is very long. So we have 31 pair of spinal nerves. And for frog, it is 10 pairs. So frog is very easy. Cranial nerve arising from brain, 10 pairs. Spinal nerve arising from spinal cord, 10 pairs. Sir, why you are giving this extra data? Should we know this extra data? Yes. Because this is related data. This is related data. Sometime we are asking which portal system is present commonly seen in frog. Like hepatic portal system is common in frog and human both. But when at the same time when we talk about renal portal circulation or renal portal system, not present in man, but present in frog. So that's why some data, related data, you should be knowing. Because if the paper in biology also levels up, like physics and chemistry, they will ask little bit related surrounding data they can ask. So this data, we should be knowing this. But again, when we will study frog, we will be knowing this. So here, 10 pair is the answer. Next statement, pituitary gland statement. Let us talk about the pituitary gland question. So first statement, pituitary gland is divided anatomically into adenohypophysis and neurohypophysis. It is a correct statement. Yes, guys, this is a correct statement. Divided anatomically into adenohypophysis, neurohypophysis, correct. Secretes FSH, correct. Secretes MSH, correct. Does not secrete prolactin is wrong. See, this is secreted by adenohypophysis. MSH is also secreted by the adenohypophysis because our case, the pars intermedia is merged to pars distalis. So we can say that. And prolactin is also secreted by adenohypophysis. So this becomes a wrong statement. Remaining statements are correct. So A, B, C are correct. And D is the wrong one. Okay. Moving to the next question. Yes, this one. 115. Which of the following is not the part of central nervous system? Again, this is a little bit tricky question, I can say. Which of the following is not the part of central nervous system? Easy also at the same time, because they have mentioned here pericardium. What is pericardium? Pericardium is a double membrane layer covering of your heart. What are the other things? Dura matter, arachnoid matter, pia matter. What are they? They are meninges. Like your lungs is covered by double layer pleura, heart is covered by pericardium, kidney is covered by the renal capsule. Similarly, your brain is also protected by the meninges. Brain is also protected by the meninges, outer layer, dura matter, middle layer, arachnoid matter, and pia matter in contact with the brain. So what type of question they can ask? What type of question they are asking? Which of the following meninges is in contact with the brain? Pia matter. Which is the most outermost layer of the meninges? Dura matter. Yes. Now tell me, what is spinal cord protected by? What is spinal cord protected by? Brain to protected by the meninges. What is spinal cord protected by? Is the spinal cord also having the same meninges or some different protective layer is there? Answer me. Spinal cord is also having the same meninges, yes or no? Or dura matter, pia matter, arachnoid matter only on the brain? Dura matter, arachnoid matter, pia matter only on the brain, on spinal cord also? Don't say vertebral column, beta. We are talking about the protective covering. Answer is yes. Brain plus spinal cord, both are protected by meninges. Both are protected by the meningeal covering. Am I clear? Hello. Is your spinal cord and brain different part? Is spinal cord a separate part or spinal cord is the extension of the brain? Spinal cord is extension of the brain. Are medulla oblongata extends into spinal cord we studied na? So spinal cord is extension of brain. That's why you say brain and spinal cord are the part of central nervous system. Both are protected. Both are protected by meninges. Your brain is also protected by meninges, dura mater, arachnoid matter, pia mater. Your spinal cord is also protected by dura mater, arachnoid matter, pia mater. It is the whole covering. Not only brain, but spinal cord is also protected by meninges. On brain, it will be called as cranial meninges. On spinal cord, it will be called as spinal meninges. But meningeal covering is for both of them. Are we clear with this, guys? Hello, are we clear? Yes. So answer here is pericardium. Answer here is pericardium because pericardium is the part of heart. So clearly, a non-biology student can also mark this answer as pericardium because cardium is related to heart, not related to the central nervous system. Next question, come on. Echinodermata question, let's see guys. 119 statement 1 is saying when any plane passing through central axis divides the organism into two identical halves, it is called as radial symmetry. Yes. Any plane passing through central axis dividing the body into two equal halves is radial symmetry. Only single plane passing is bilateral symmetry. Not a single plane passing through central axis is dividing the body into two equal halves. No plane is dividing the body into two equal halves. Then it is asymmetry. Single plane, bilateral. Any plane, radial. So this statement is correct. However, second statement is wrong. Echinodermata, both adult and larva are radially symmetrical. This is wrong. Larva is bilateral symmetry. Adult is radial symmetry. So first statement is correct. Second statement is incorrect. Direct NCERT line. Now we will direct go to the next question. 121. The number of vertebrae in human is. What is the number of vertebrae in human? Tell me fast. How many vertebra? How many vertebra, guys? Tell me fast. C7, T12, L5, S1, CO1. Yes or no? Yes. C7, T12, L5, S1, CO1. 7 cervical vertebra, 12 thoracic vertebra, lumbar 5 vertebra, 1 sacrum, 1 coccyx. Am I clear? Combine them all, we will get 26 vertebra. Are we clear? Technically speaking, when we were in the fetal stage, in fetal stage we had 33. In fetal stage we had 33. Sacrum got fused. Sacral vertebra got fused to become sacrum bone. Coccygeal vertebrae become fused to become the tailbone coccyx. So at higher levels, you will study that fetus has 33 vertebra. Later in adults, some of them become fused. And now we have 26 vertebrae. Are we clear with this? Okay. Moving ahead. Going ahead now. Next. Where is the next question? Yeah, this one. The number of action potential generated by sinoatrial node in a healthy human is. Sinoatrial node is the pacemaker. It has the ability to generate the maximum number of action potential. See, conducting tissue you studied, na? SA node, AV node, bundle of his, Purkinje fibers. These are the different conducting tissue of your heart. They have a special ability. They are specialized cardiac muscle. They are specialized cardiac muscle. They don't contract and relax. Conducting tissue of heart will not contract and relax. They have the ability to generate the action potential, the impulses, which will stimulate your cardiac muscles and keep contracting and relaxing. Are we clear? So, SA node can also generate action potential. AV node can also generate action potential. Purkinje fiber can also generate action potential. But why we say SA node is the pacemaker? Why we say SA node is the pacemaker? Because SA node generates highest number of action potential. That is roughly 70 to 75 beats per minute or action potential per minute. AV node also generates 40 to 60 something. Purkinje fiber also generates 15 to 20. But that is not sufficient. That is not sufficient. That will not generate enough cardiac output. Cardiac output will drop. Your organs will not get blurred and the person will die. Are we clear with this? So this question can be asked in much better manner, that why SA node is the pacemaker. Assertion reason. SA node is the pacemaker. Why? Because it generates the maximum number of action potentials. Are we clear? Moving ahead, next. Next is again locomotion chapter question. They are asking about the arrangement of the lower limb bones. They are asking about the lower limb bones. Yes, Suharshita, yes, correct answer. Yogi Vardhan, maximum AP. Sugana, yes, correct answer. Gamer, correct answer. More number of action potential is there. Okay, arrangement of the bone in the limbs. What is the arrangement? Okay, first is your femur, thigh bone, the longest bone, femur. Then you have the patella, kneecap. Then we have in the shin area, you are having the tibia and fibula. Then we have the tarsals. Then we have the metatarsals. They are connected to the phalanges. That's your arrangement of the lower limb. So which one matches? Femur, patella, tibia. They have mixed the fibula. By the way, in reality, you can survive without fibula also. No problem. Fibula can be removed. No issues. It can be used for other purpose in surgery. So with tibia also you can survive. So tibia after tarsal, that is the correct arrangement. Okay, not as per the textbook, but in the given option, this is the much more better arrangement. Are we clear with this? Sir, timing of classes in the Gosalites, morning 7 to afternoon 1. Morning 7 to afternoon 1. This will be our most of the legitimate timings mostly. Okay? Going ahead. Next question, guys. Come on. Hello. Sperm motility. What a difficult question they had asked. Sperm motility. Flagellar movement. Now let's make it little difficult. Okay? Are you ready, guys? If I am the examiner, how I will ask? Sperm flagellar movement, most of the students know it. 8-9 student will also know it. Okay? So, let's make it little difficult. Which is the cytoskeletal element present in the flagella? What is the cytoskeletal element present in the flagella which makes the sperm motility? Which is the cytoskeletal element present in the flagella which helps in the sperm motility? Come on. Yes, Yogi Vardhan. Correct answer is microtubule. Correct answer is microtubules. Yes, gamer, microtubule. See, NCERT has mentioned for amoeboid movement. NCERT has mentioned for amoeboid movement. Suharshita, microfilament is for amoeboid movement. Microfilament is for amoeboid movement. Muscular movement, muscle fiber, actin, myosin will be there. Ciliary movement again, microtubule will be cytoskeleton element. So see, whenever you are studying any question, the related information, your mind should be clear. I know cytoskeletal element is going in botany. It is taught in botany, but you should be remembering this. Which part of the sperm structure has a 9+2 arrangement? Answer. Which part of the sperm has 9+2 arrangement? Now 9+2 arrangement is seen where? Yes. 9+2 arrangement in which part of the sperm? Flagella. Yes. Sugna centriole में भी है. Centriole also has the microtubule, but centriole is mostly required for the cell division purpose, and it is 9+0 arrangement. My question is 9+2 arrangement is present in which part of the sperm? I will say the flagella. Yes. Are we clear, guys? So this kind of applied questions, if they are asking, they are combining the topics of botany and zoology, they can make more better questions. So expect some better questions. These are straightforward questions. Next, 137, come on. Let us talk about Abingdon tortoise competition, a very important concept from organism and population. The competition paragraph, predation paragraph, it's very important. A lot of questions can be made on that. First, you study competition. Limited resources are there. So different species fight with each other. Interspecific competition, said by Darwin first. But we know today, competition can occur between same species also, different species also, same species intraspecific, different species interspecific competition. Then sometimes the competition is such that resources are not limiting. Resources are enough. but still competition is occurring. Presence of one competitor is inhibiting the feeding habit of the another. This is called as interference competition. Like I am eating and someone is coming and watching me like this. Will I be comfortable to eat? I will not. So I may get up and leave the food, but that is causing me problem. So that is interference competition. Okay? Interference competition. Second is that when resources are limited, Gauss exclusion principle. Hello guys, am I audible now? Am I audible guys? Yeah, little bit battery went low. Okay. So now I think the voice is normal. Yeah. So what I was talking about? Yeah. So I was talking about competitive exclusion principle. What Gauss said, limited food. Food is limited, finite. Superior one will eliminate inferior one. So once upon a time, Galapagos Island, Abingdon tortoise were happily living, chilling their life, eating grass, surviving. No other competitor was competing with them. But suddenly, human comes. Human, wherever they go, they damage. Yes? So human came with the goat. Okay? So human came with the goat. And the goat started browsing very fast. Browsing is not that internet browsing you do. Browsing here is grazing. Browsing is eating the grasses. So the goat efficiency was much more. It ate very fast. It was not directly competing with the tortoise, but tortoise efficiency was low. Goat's efficiency was high, and goats are more better browsers. So what happened? The food after 10 years, in a decade, the food was gone for the tortoise. So tortoise gone. Tortoise were removed from the Galapagos Islands. So here the goat excluded, removed the competitively superior. The goat excluded the inferior one. So this is proving your Gauss competitive exclusion principle. Same thing is mentioned here, guys. Abingdon tortoise in Galapagos Island became extinct. Within a decade after goats were introduced, goats were more efficient at browsing than Abingdon tortoise, and that was the reason goat is always goat. So they will remove the tortoise. Are we clear? Yes or no? Yes. Now, third concept. First concept is interference. Second concept is competitive exclusion principle. But then we study one more topic, competitive release. What is the topic? Competitive release. Competitive release, that is a small note given on the NCERT about the Balanus and the Chatamellus. Balanus and Chatamellus, these are the two invertebrates. About them they have given. Balanus is the dominant one. Chatamellus is the smaller one. So Balanus one dominates the intertidal area. Balanus is near the water. It will not allow the inferior Chatamellus to come near. So in an experiment, Balanus was removed. Superior species was removed. When superior, competitively superior one is removed, automatically inferior species will increase in the number. So when competition is removed, competitive superior is removed, inferior number will increase. So that is called as competitive release. Competition is released. So competitive release means when the superior goes away, inferior number increases. That is competitive release. Again, connecting topic, MacArthur observation. MacArthur observed, or the other people also observed, the ecologist also observed. They said that Gauss competitive exclusion principle is not applicable completely. In fact, it is avoided most of the times. So Gauss competitive exclusion principle is only applied in some cases, not in all cases. In majority cases, everyone wants to live together. They want to live happily like a family. They will share their resource. There will be resource partitioning. So MacArthur warblers, he noticed some birds living on the tree. They have different foraging habit. Some is eating in the daytime, some is eating in the nighttime, some are eating fruit, some are eating insects. They are avoiding the competition. So that is resource partitioning. That prevents the elimination of the other species. So resource partitioning will keep all the species together. It will not eliminate. It is against the Gauss competitive exclusion principle. However, Gauss competitive exclusion principle only applicable for some cases only, not universally applicable. Are we clear with this? So this is the correct explanation. Yes, guys. Are we clear, everyone? So see, in a very short time, 5 minutes only, we understood interference, Gauss competitive exclusion principle, competitive release, and we also understood the resource partitioning. But when we start the topic in more easy, slow class, we will go there. Are we clear? So let us take the last question now. I know your paper is pending. In the next class, we will quickly take the other questions, and we will start with the tissue topic in the next class, that is day after tomorrow. So let's do this question and we can close the zoology class now so that your physics class can start. Are we clear? Am I clear, guys? So both species are harmed. In competition, both get minus competition. So A is 3. One is harmed, one is benefited. That can be possible in predation also and parasitism also. So here possible only predation is there. Okay. So your B becomes 1. Both species are benefited. Both are benefited in mutualism in the case of lichens or mycorrhiza. Okay. Or the pollinators, plant and their insect pollinator, mutualism, both are benefited. And last one is benefited and another one is neither harmed, neither benefited, plus N0. Plus N0, that might be the case of cattle and egret bird, that might be the case of the whale and the barnacles sitting on them, or the epiphyte growing on the mango tree. That can be the example of commensalism. So D will be your fourth. Your answer is 2. 139 also we can do. Which of the following is not the part of male reproductive system? Last time when we studied infundibulum is the part of female reproductive system, the funnel shaped part. Yes. So here we will stop, guys. So I hope you understood some concepts. You got a little bit of idea, okay, how we are going to go about in the class. Okay. Some concepts we did very fast, but when we start with the class, we can go in a more slowly and a detailed manner. Are we clear? So that's all from my side, guys. Bye-bye. Thank you. Take care. See you in the next class. Bye, guys.